Hello, I'm Dr. Sonia Davison. I'm an endocrinologist and women's health expert. I'm delighted to be with you as part of the endota wellbeing conversation. I've worked in women's health since 2001. It's been an absolute pleasure to work with women. I did a PhD looking at 1,423 Australian women's hormones and their relationship with age, menopause, brain function and sexual function. It's an absolute pleasure to look at women's hormones, to care for their health and help them age gracefully and naturally and safely. Hot flushes, mood changes and sleep disturbance, they are all cardinal symptoms of menopause. Knowing that your body is undergoing this change is the very first step. Menopause is normal from 45 till about 55, although some are a little bit older and younger. Symptoms can happen in 20% of women, which can be severe, drenching night sweats, not sleeping at all, getting so anxious that they can't drive anymore. They are really affected really badly, those women. But 20% just sail through it and don't notice anything. 80% of women will have symptoms throughout menopause. Just be aware that your body will undergo this change. It is natural, but I don't want you to be putting up with symptoms that bother you. I want you to sleep, I want you to feel well, and I want you to do the things in life that you want to do. When we look at what's happening at menopause, again, it goes back to hormones. So estrogen is on average about 400. That's the level of estrogen. We don't need to measure hormones at menopause. That's very important to know. But that average 400 for a reproductive woman sinks to an average of about 20 at menopause. So no wonder women are getting symptoms because their hormone levels or their estrogen is really just dropping right out. Progesterone we only have if we are producing eggs. So once we lose that last egg with menopause, average age 51 to 52, there is no more appreciable progesterone. And testosterone, my PhD showed, is half by 40. It's got no relationship to menopause, but it does hit the skids at age 65 years. When someone comes to me around the age of menopause, they're often at the peak of their careers. They're caring for dependents, they're in a relationship, they may be caring for elderly parents. So their whole world is very busy, and then they've got these normal changes in their body that can lead to symptoms. The thing that I see when women come to see me as a doctor, I want to be healthy, I want to be well, I don't want bothersome symptoms. How can I do this? It's my job to help them, it's the job of other doctors to help them as well. Practical ways women can support their well-being through this life stage. 1, knowing what's normal. So getting armoured with some good advice and education. 2, getting some good help. 3, having that balance. Doing your exercise. Eating healthily if you can. Avoiding substance abuse. Having some fun. Doing some weight-bearing exercise for your bones, for your heart. Keeping a healthy weight for your height. It all peels off my tongue and from my mouth very easily. I know it's hard for women to do these things, but women do feel empowered when they take hold of their health and when they do make even small changes. So if you're listening to this, try and make at least one change for your health, whether it's walk the dog a bit more, park further away at work, try and lose the 1 or 2 kilos you've been hoping to lose. Do some dancing, stop the vapes or smoking. You can do it. I'm going to help you do it. When women shift out of reproductive mode, they're essentially postmenopausal. These women have valuable life experience, wisdom, and are free of the challenges of periods, hormonal fluctuations, PMS, endometriosis, and concerns about fertility. After the menopause transition, many women describe feeling more stable and free of hormonal fluctuations. The powerful truth about menopause I wish every woman could know is that we can make some very useful lifestyle adjustments at this point in life, which will help women be healthy from midlife and beyond. Understanding how the body works helps us care for it more intentionally. To learn more from the Endota Wellbeing Conversation and explore simple ways to support your health and longevity, visit endota.com.